My name is Dr. Teni Brown, and I'm an assistant professor in the Department of OBGYN at Northwestern Medicine in the Division of Female Pelvic Medicine and Reconstructive Surgery. I have been a resident at Northwestern Medicine. I chose to stay on to complete my fellowship in female medicine and reconstructive surgery at Northwestern Medicine, and now I'm on as a faculty member. I chose to stay here because of the wonderful opportunities for collaboration, support for innovation, and just a community that really cares about providing the best possible care that we can for women in Chicago. I have the fortune of working in a transdisciplinary team, and so that involves nurses, pelvic floor physical therapists, colorectal colleagues, urology colleagues. And this is so important because you can provide a comprehensive approach to how we take care of women. And that's one thing that I'm really fortunate to have at Northwestern Medicine. My clinical interests include treating pelvic floor disorders, and so that includes conditions like pelvic organ prolapse, urinary incontinence, fecal incontinence, as well as other disorders of the genitourinary tract. My approach to taking care of patients is really one that's collaborative. I love to sit down with a woman who comes in to see me for one of these conditions, listen to what her goals are, what her experience has been, so that we can really spend time and take a shared decision-making approach. And what I mean by that is, I'm not here to impose what I think the best treatment is, because ultimately I believe the best treatment is one that matches the patient's goals, what she's comfortable with taking on. And we formulate a plan that fits all of those things so that we can have the best outcome. As a urogynecologist, one of the conditions that I treat is urinary incontinence. There are two types of urinary incontinence: stress urinary incontinence and urgency urinary incontinence. Other conditions that I treat include pelvic organ prolapse, fecal incontinence, as well as other conditions that affect the genitourinary tract. We can offer patients several treatment options for their condition. So for urgency urinary incontinence, we start with behavioral and lifestyle modifications, and then we can move forward in a stepwise fashion and add different modalities if something is not working. Another mainstay of treating urgency incontinence is medication. So we have several medications that we can prescribe that act to relax the bladder so that it can relieve that urgency and allow women to hold a little more in their bladder without having leakage. And then we have advanced therapy options, and this has really been a booming part of our field and our practice. One of the exciting therapies that we have for urgency urinary incontinence is sacral neuromodulation. This is actually a modality that has been around since the 1990s. However, there have been some really clever and important innovations to this treatment. So sacral neuromodulation involves placing a thin wire in the lower portion of the back, and this wire is attached to a small battery that's about the size of a quarter. The device sits under the skin in the lower portion of the back and then sends electrical stimulation to the bladder to improve urinary incontinence. Historically, this device needed to be changed every 5 years and was not MRI compatible. However, recently, there's been a newer device on the market that is rechargeable, and so now the device doesn't have to be changed for about 15 to 17 years, and it's MRI compatible. And most importantly, the treatment results are fantastic. We expect that patients will experience at least a 50% improvement in their symptoms, which is huge when you think about the debilitating impact of this condition, having several leaking episodes a day, having to wear pads. And when we look at the studies on this therapy, it's over 90% of patients have this sort of improvement, which is really groundbreaking and exciting. It's a game changer. My favorite part about being a urogynecologist is taking care of women and improving their quality of lives. The conditions that we treat are truly debilitating. And when I can offer something that is going to allow a woman to resume her regular activities, spend time with her family and friends, it is the absolute best part of my job. We are an evidence-based field. We are able to really innovate in ways that optimize treatment for patients and recovery for patients. And with a lot of our advances, I'm able to perform my surgeries in a minimally invasive fashion and get patients home on the same day, which really optimizes their recovery and is a huge patient satisfier.